let's tell people where they can go to find an appropriate healthcare provider that's skilled to treat any type of concussion.
Yeah. Well, I mean, I'm obviously biased, but our complete concussion management.
Okay.
If you're anywhere, at least in North America, Australia, we don't have as many right now in the rest of the world, and obviously the US we just started getting into. But if you go to completeconcussions.com/find-clinic, you'll be able to see a whole map of clinics, and it's geolocated to your area. So if you click on that, and you might be able to find a clinic in your area. If not, I mean, it's tough. There's a lot of practitioners out there that will be, let's say, like vestibular trained, and will say, I treat concussions, but they're treating just the vestibular end of things. And so I think there's a lot more to concussion than just vestibular or just visual or just cognitive. Somebody mentioned here in the questions about cognitive rehab. There's a lot more to it, and I refer for cognitive rehab all the time. So I want to point that out there. But yeah, so I would start with completeconcussions.com. If you can't find anything in your area, then try going through family doctors and sports med and looking for PTs in your area that have training in it. There's you're kind of piecing it all together, and that was the whole genesis of our program, is to try and give people kind of a one-stop shop and give clinicians a broad overview of everything concussion related, so that they can
yeah.